Namaste, everybody. Today I want to talk a little bit about PTSD for the next few moments. And at the end, I'll kind of put a prompt up there as well. But what I'd like for you to think about in your life, how you have labeled PTSD and what that really means as we dive into it. So I'm going to go through some definitions, going to go through some research that I've found, and I'm going to post this up there for you guys to see. So I'm going to read a lot of this in the beginning, and then I'm going to kind of recap and rephrase at the end. But PTSD, it's a mental and behavioral disorder that can develop because of exposure to traumatic events such as sexual assault, warfare, traffic collisions, child abuse, domestic abuse, or other threats on a person's life, and is considered an anxiety disorder. So think about that if you're ever seeing anxiety disorders, that PTSD is in that realm as labeled as well. So the lifetime prevalence of PTSD is around 6.8 to 8.7 in the US. So think about this in a sense that it's about 9.7, about 10% of females compared to about 3.6 of males, right? So this number is it's behavior treatments that have affected individuals with PTSD, cognitive processing therapy, prolonged exposure, all those things, SSRIs, right? So all of these things have been proven to help. And I'm going to talk about some of the methods that have been proven to help, some of the things to avoid, and then from my experience personally of what's helped with me and hundreds of others with PTSD over the last 7 years. So neuroimaging in the amygdala. So recent neuroimaging work has increased and that the amygdala responds to emotional stimuli and dysfunction within regions mediating top-down attention control. So I'm going to give the definitions of this in this handout as well, so you can research it with all the information. All right, so here's what I want you to think about, that this report, specifically this one, examines amygdala responsiveness to emotional stimuli and the recruitment of top-down attention systems as functioning task demands in popular U.S. military service members who have recently returned from combat deployment in Afghanistan and Iraq. Okay, so these are combat veterans but have not been diagnosed with PTSD. Okay, so there's stress, there's some anxiety, some things like that. So it showed an increase in activation in regions associated with emotional processing, object representation, and top-down attentional control as a function of increased PTSD symptomology. But remember, these guys have not been diagnosed with it. We suggest that this data may reflect two phenomena. First, that the data indicate increased emotional responsiveness by a positive relationship in PTSD and the amygdala responsiveness to emotional relative neutral stimuli, and greater bold responsiveness as a function of PTSD symptom severity in regions implicated in emotional and representation during emotional relative neutral conditions. An increased connectivity between the amygdala and regions impacted in emotion, right? And representation of this function of PTSD symptom severity during emotional relative neutral trials. Second, the data indicate greater need for recruitment in regions implicated in top-down attention as indicated by greater bold responsiveness and superior middle frontal gyrus as the function of PTSD symptom severity and lack of relative view conditions. So basically what they're saying here is that PTSD and the amygdala all are affected, right? Even with people that haven't been diagnosed with anxiety, stress, and things like that. So this is a really neat article. Now, bottom up and top down. So the brain is limited in capacity to process all sensory stimuli present in physical world at any point in any time, relies instead of the cognitive process of attention to focus neutral resources according to the contingencies of the moment. So think about attention can be categorized into two distinct functions. Bottom-up attention, referring to as attention guided purely by external driven factors to stimuli that are salient because of their inherent properties relative to the background. And top-down attention, referring to attention guidance of attention based on prior knowledge, willful plans, and current goals. So Top down, people are much slower to make more mistakes when the meaning of the word and the color doesn't match. So for example, people have a harder time when the word red is printed in green instead of red ink. Top-down processing explains why this task is so difficult, right? People automatically recognize the word before they think about the specific features of that word, like what color is it written in? This makes it easier to read the word aloud rather than the color of the word. Okay, so cognitively, this is what's going on, right? We're seeing some things and it's harder for us to dissect it, interpret it, rationalize with it. Okay, so when your amygdala becomes enlarged, right, there's a disconnect, the hippocampus as well. So here's the time frames to cure PTSD. To me, this is very, very relevant. So talk therapy treatment for PTSD usually lasts 6 to 12 weeks, but it can take longer, okay? Now this is from the National Institute of Mental Health. Now from the Library of National Medicine, this is a really very intriguing to me. It's 27 and 50% of cases recovered within 3, 6, and 24 months, and 77% within 10 years. The longest duration allowing stable estimates. Time-related recall bias was found largely for recoveries after 24 months, so after 2 years. Recovery was weakly related to most trauma types other than very low. So low trauma, quicker time to recover. Okay, so think about that in this dialogue as well, right? A lot of us have been exposed to a lot more trauma for a lot more time. It's going to take a lot longer to heal. If you've had mild trauma, then it's going to recover quickly. So here's some more methods to help. Cognitive processing therapy. So 53 for every 100 people with PTSD who receive trauma-focused therapy, 53 will no longer have PTSD after about 3 months. 9 out of 100 people with PTSD who do not receive treatment, 9 will have PTSD after about 3 months. CBT usually takes 12 weekly sessions. So treatment lasts on average about 3 months, and the sessions are 60 minutes. Now, eye movement, EMDR. A lot of you guys have heard this. This may be new to you, but 53 for same statistics, every 100 people with PTSD who receive trauma-focused therapy such as eye movement will no longer have PTSD after about 3 months. 9 out of 100 people with PTSD do not receive treatment. 9 will no longer have PTSD. Same thing. So what is this treatment like? Now, this treatment, the EMDR, is 1 to 3 months weekly of 50 to 90 minute sessions. Many people will start to notice improvement after a few sessions, and the benefits of EMDR can last long after your final session with your provider. Prolonged exposure, they also call it PE, same statistics, 53 out of 100 who receive trauma-focused therapy, 53 will no longer have it after about 3 months. Okay, so as you get the statistics, it starts to sink in that, hey, this isn't going to be a cure for everybody, and this is going to take time. Okay, 9 out of 100 people with PTSD do not receive treatment. 9 will no longer have PTSD. Same thing as before. Now this PE, prolonged exposure, takes 8 to 15 weeks, weekly sessions, and treatment lasts for about 3 months. Sessions are an hour and a half, and you start to feel better after a few sessions. And the same thing, long-lasting benefits. So SSRIs and SNRIs. 42 out of 100 people with PTSD who receive this treatment will no longer have PTSD after 3 months. So it takes that long for the medication to dive in. 9 out of 100 people with PTSD, same thing. 9 will no longer have PTSD. Now, how long does this treatment last? Well, you may start to feel better in about 4 to 6 weeks, but you have to take the medication to keep getting the benefits. So if you're on medication for your PTSD, you're going to have to take that for the rest of your life. Right? So some of these other options are a holistic, more healthy approach to take accountability and to be able for you to, get off the medication possibly, or to have better treatments or other forms of treatment. So there's other ones, TRP, tactical resilience process. Now there's not a specific time link for this therapy. It can last from 1 session to months or even years. And it depends on what you want and what you need. Some people come to counseling with a particular problem that they need to solve and might find that 1 or 2 sessions are sufficient. Now, once again, let's go into some more of this. So there's also the aspects of cannabis, right? So this is the data from 404 medical cannabis users, and this is a really neat, and if you get a chance, click on this link and see it. But it was a 30-month long study, and the results indicated that the present study indicate that acute cannabis intoxication provides temporary relief from intrusions, flashbacks, irritability, and anxiety in individuals self-identifying as having PTSD. However, baseline PTSD symptom ratings did not change over time, and we detected evidence that people used higher doses to manage anxiety over time, which may indicate of the development of tolerance of the drug. Collectively, these results indicate that cannabis may reduce PTSD symptoms in short term, but may not be an effective long-term remedy for the disorder. Future research needs to, occur. So here's what I kind of like is some of the adverse effects. Patients did not report many adverse effects or disadvantages of using cannabis. The main unpleasant effects were related to taking too much cannabis. Bernie, one of the participants, says, "When I take too much, I get emotional." And that's very strange to me. I don't know that at all. And then I'm crying on the couch and my wife is looking at me like, "What is this?" And I think, "Yes, what is this?" And so Harold said, "With too many drops, when I get out at night, I can feel really lost and really disoriented." So from the conversations I've had at the VA hospital, they said that with THC, and I talked about this in a previous video as well, is that it's supposed to be very minute amounts, but we overconsume. And then when we overconsume, it amplifies our anxiety and our stress and all these other things. So if my suggestion is if you're going to just look at this as a treatment option or an option for helping you, small, minute amounts. Less is better. Micro doses of all of that, all right? And there's another study in here that talks about how it helped, with patients, and that they expressed, reduce or stop the use of other medications, and that they reported having done so. And so that cannabis actually helped them with their journey and their path, and helped them not take any of the other types of medications as well. So there's some definitely benefits to cannabis, especially if you feel like you're going to need to take prescription medication for the rest of your life. Maybe cannabis is a better option and an alternative. Now, neurofeedback, that's a kind of a biofeedback which teaches us self-control of brain functions to subjects by measuring brain waves and providing feedback signals. Neurofeedback usually provides an audio and video feedback, and I put this in here. Now, there's a resource in Denver, Colorado for you guys, and it's really, really awesome. Now, some of my friends have taken this, and they do a scan of your brain before you go through the neuro processing, and then and it's challenging for them to explain, because basically they're like, "Hey, I'm watching Netflix and the screen just gets blurry," and what it's doing is reprogramming your brain during certain intervals. Then they'll do a brain scan afterwards to see the changes, and so you can see this visual representation of before and after. Now, spiritual outcomes. I like this study, of course, because I feel like there's been a spiritual disconnect for us. And what this does is provides an opportunity for you to think about your spiritual journey. And maybe for you it is a religious journey, but maybe it's just a general spiritual journey. What they notice is that there's struggles at a baseline were predictive to poor PTSD outcomes. In contrast, PTSD's symptomology as a baseline did not predict any of the spiritual variables of post-treatment. In keeping with spiritual integrative approach to treating combat-related PTSD, the results suggested understanding the possible spiritual connect of veterans' trauma-related concerns might and prognostic value and equip clinicians to alleviate PTSD symptomology among those veterans who possess spiritual resources or are somehow struggling in this domain. So think about your spiritual journey, your spiritual path, and what that really means, all right? Another one, and this was OEF, OIF, and OND military, right? And so that they've said that, it's been associated with greater mental well-being for military veterans. But this work has been conducted primarily with older veterans. And the results in this sample, so they call it RS, so religious spirituality, organized practices and private prayer minimally related to mental or physical well-being, yet RS struggle related inversely to concurrent and subsequent mental and physical health. For women only, higher baseline organized RS was associated with lower subsequent stress, anxiety, and insomnia. For men, only baseline RS coping predicted subsequent poor physical quality of life, and baseline RS struggle predicted subsequent increased pain. For minority race but not white veterans, higher baseline private prayer predicted increased current pain level at 12 months. So it's really neat. So basically the conclusion is RS broadly conceptualized may relate to well-being in military veterans in different ways, depending on sex, race, ethnicity, and the implications and the roles of your religious and spiritual background. So you want to make sure that this is a journey of love and acceptance and hope and peace, that it's not out of guilt and shame, okay? Now we're going to dive into guilt and shame. So all three trauma-related cognitions, wrongful doing, insufficient justification, and hindsight, basis of responsibility, reduce significantly over the course of treatment. So guilt has been reduced over a 3-week CBT-based intensive treatment program, which is really, really great. I think it's awesome because we hang on to a lot of guilt and shame. And then there's some other links in here. I'm not going to go over it with this talk this morning, but guilt is strongly associated with suicidal ideation among military personnel with direct combat exposure. Brains with more vitamin D function better, right? Randomized placebo-controlled. So they're also doing this trial, and it's still in the works, of your gut health, your microbiome health, and how that helps with or affects PTSD. Changes in guilt, here's another one, with veterans who experienced military sexual trauma, hyperarousal symptoms, and then this is CBT based with the 3-week for veterans with PTSD. So I put some links in this document for you to check out. Hopefully that you will check them out. Methods that do not help, I'm just going to throw this out here: alcohol and drugs, right? I don't have to go into statistics and prove all that, but you already know that it provides an opportunity to disconnect instead of connect. The other thing I want you to think about, and this is on the suicidal aspect of it, is that altitude. Higher altitude affects the way that we process and think cognitively. And there's a higher rate of suicide in higher elevations. So if you feel a little depressed, a little anxious, and you live in a higher elevated area, please do whatever you can to maybe relocate to a lower elevation. Okay, that's in there as well. Now, I want you to think about some other benefiting factors. I want you to think about all the self-care concepts. Now, I'm throwing this out there. I'm writing a book over this in my life and my journey. I'm expecting it to be published at the end of 2023. Mindfulness and meditation. Now, mindfulness is the opportunity to be present, to be in the moment without social comparisons, to give yourself the opportunity to find hope, to find acceptance without non-judgment, right? Meditation is the process of using this in your daily life. So you can be meditative as you're driving to work, as you're driving home. You can be meditative in all types of aspects of your life. But I really want you to think about finding acceptance for who you are and unconditional love for who you are today. Mission statement. Get your mission statement established. Think about your vision, your goals. It kind of gives you a purpose and a direction of where you want to go. And also goal setting. Setting some type of goal, could be anything small to anything large, for yourself this year or next year. Living intentionally. What does that mean? That means you get up every morning and you set an intention. So today's intention is courage. Every conversation, every interaction you have with yourself and our community is about courage. If your intention today is forgiveness, every interaction and every conversation you have with yourself and others is about forgiveness. That's what that is. Exercise has been proven fact to help mild and moderate depression, right? Get enough sleep. Establish healthy boundaries. Meal planning. Organize your life, right? organize your meals. System 1 and System 2. System 1's that automatic process of like, hey, I've reacted this way, and then after you kind of look back and analyze it with like your System 2, it's like, well, why did I do that? Why did I behave in that manner? And then you start having the guilt and the shame. So what we got to do is take your System 2 to reprogram System 1 so that you're more methodical, you're more present, you're more in the moment, and you're not so anxious and stressed all the time, and that you get plenty of sleep and you're exercising. I've put in here some great resources. Of course, my nonprofit, MyKC. We can do life coaching, right? We can help you with a lot of these things. I want you to think about, like, what I do is the first thing we focus on is your mission statement. Once that's established, then we go further. Now, they're 30-minute sessions. We can accomplish self-care. We can talk about healthy boundaries, turning conflict into intimacy, your mission statement. All these tasks can be accomplished with a conversation within 30 minutes, and then we go further after that, okay? Warriors Ascent, by far, is, the program that I've been working with exclusively for 7 years. And I've heard numerous times how this program has transformed and saved my life. I hear this all the time on Thursday and Friday. It's a 5-week program, starts on Monday, ends on Friday. So towards the end of the week, people have really fallen in love with who they are, and they understand what self-care is and what that means. Mindfulness in the Heartland, Amy has done an amazing job, so connect with her. Now, there's some other ones that have been referred to me. So mindfulness-based stress reduction and AMRA. There's a prompt in here that prompted this research. I put that link in here as well, how he has said that he can heal and cure PTSD within 4 hours. And I thought, well, okay, let's check this out. Let's see what this is about. So there are situations where people can be healed and cured if your PTSD is low. My concern with this is over-promising. So I'll never promise that, you can be completely healed and cured. I can say that during our journey and our path together, right, with life coaching, with focusing on mindfulness and meditation, that it can be subdued, that it goes down. But there's still going to be times in our life where we lose our temper, or PTSD becomes more engaged and amplified in our life. And there's a lot of triggers and a lot of reasons why. It could be stress on the news. It could be because of the stress of society pressures. It could be because of COVID, right? And so our environment, our life has been stripped away. All the things that we enjoy doing were taken away, and now we have to wear this mask. And what has happened to us? Now, because of that, our suicide rate of veterans is a lot higher than normal. Our suicide rate of America is a lot higher. The most important thing I want you to think about on this journey and this path is that I'm here for you. And to find that sense of community within your community. Find people that are really, truly here for you, and that they're not going to promise you something that they can't uphold to. Now, not to say that PTSD can and cannot be cured within 4 hours, right? But I'll never promise you that. What I will promise you that is if you put in the work and the dedication, you're going to become the best version of yourself. Now, 4 hours to me is the baseline in the introduction to talk about breath work, to talk about mindfulness, meditation, to talk about self-care, healthy boundaries, turning conflict into intimacy, establishing your dreams, visions, and goals based around intentional living, which is also based around and completely your mission statement. That's the foundation, but that work has to continue on after and after. So I want you to realize that if you go through some specific any type of therapy at any level and you feel really good immediately after, but then 3 months, 6 months, 12 months down the year, things may have come back up or it may be worse, don't look down upon yourself that you're a failure. Don't ever do that. That may not have worked long-term for you, but maybe you need to revisit or enhance or go into more types of modalities. I'm going to encourage you to never believe that one thing fits all and is going to fix everything that you've got going on in your life permanently. That's what I really, really want you to think of. I don't want you to lose hope. That's one of my biggest concerns on this, is that people are over-promising and under-delivering modalities that are going to help us in the long term. A lot of these are going to help in the short term. I could go eat a piece of chocolate and I'm going to feel good, but what are going to be the side effects? I can go drink some alcohol and consume that, and I'm going to feel good short term, but what is it going to do for me long term? Now, that's the same thing with our holistic approach to therapy, to healing and recovering. Because things in our life are going to occur over and over, and things from the past are going to be revisited over and over. A lot of it, we're going to transform the way we think and feel and how we see it. I call it the warrior ethos. I call it becoming that hero and that warrior that we revisit and reanalyze, but we do it with eyes of a hero and a warrior, no longer the victim. I hope you found this insightful. I would love to hear from you. I would love to know what has worked for you, what hasn't worked for you, and the longevity. So if there's a treatment that you've done once and it made you feel so much better about everything and who you are and gave you that purpose back, and it's helped you out and you only had to do it once, I would love to hear from you. Or are there things that you have to do each and every day? Do you have to be mindful each and every day? Do you have to be present? Do you have to focus on self-care constantly just to lower the amygdala? I'd love to hear your story, your journey. I'd love to hear those systems that have helped you and how long they've helped you and what that life and that journey was. And I want you to realize that, physiologically, what's going on is the amygdala becomes enlarged, right? And there becomes a disconnect between the amygdala and your hippocampus gets hijacked. Now, when you're always stressed and always anxious and you have this PTSD and you're always thinking this way, then your amygdala becomes enlarged and large and large. And you're always in this hyper arousal, hypersensitive, state of being. Mindfulness and meditation have been proven to shrink the amygdala, to help reduce that, to help you get that back. So if you've got brain fog, or you're unable to sleep, or you're unable to concentrate, or all these other things like, hey, I'm not who I used to be, it's because you're in this hyper state of arousal. Mindfulness and meditation have been proven to cure and reduce that. But there's more than that you need in your life. You need exercise. You need exercise that's going to bring you joy. I don't believe in an exercise where you're always monitoring everything you're doing, and you're always socially comparing yourself to who you were or other people. That you just go out and find joy in your movement, in your exercise. So if there's anything I can do for you, please let me know. Please let me know what has helped you on your PTS journey. Who has helped you on your PTS journey and what it's been like for you. I love you guys. I hope you have an amazing week, and I look forward to talking to you soon.